Hi everyone, it's Nicola here. I just decided that I'd do a little bit of a video blog today for those people that are awaiting surgery. So I just thought I'd give you a little bit of advice or whatever I could, because I'm now 4 weeks out of surgery, and I've got to tell you, the recovery is pretty challenging at times. You know, there's lots of things that go on for you, and especially emotionally you feel really up and down, and it's quite scary because you feel quite alone when you leave the hospital, because you haven't got the nurses, you haven't got the doctors, you haven't got the machinery or anything like that to support you, so you feel quite lonely. But I can remember 4 weeks today and hearing that I got a cancellation from the hospital, and my nerves were absolutely shattered. I was absolutely really worried about having the anaesthetic and not waking up and problems and everything. And I know that is really, really natural for everybody that's going to have any kind of surgery. So, but I remember thinking to myself the night before, well, I'm going to go in and I know that I've got to get it done, and I'm just going to be better. I had to keep my mind focused, and I had to be really, really strong. I went in on the Sunday, and my operation was due on the Monday morning, and the lady that did my operation, she was Swedish, and she was really, really lovely, and she came to see me the night before, as did the anaesthetist. So if I had any questions, and again, if you've got any questions that you'd like to ask them, write them down and make sure that you get everything out in the open, so you know that everything, the more knowledge is power, really. And I'd kind of, before when I'd gone to see her, she'd kind of said, because I was umming and ahhing about the pig's valve and the mechanical valve, and I also needed a repair, and I had a POF. A POF is when you've got a narrowing to the artery, and also I had some skin removed as well. And so there was like three things in one that I was having done. She said she was 70% that she could fix one of the valves, 90% certain she could repair another one, but the 70% she wasn't sure. And if she had to, what would I choose? And a couple of weeks prior to that, I'd gone to see her, and she said that the pig's valve would last me anything from 10 years, which I was kind of swaying towards that, because like a lot of you, I didn't want to take the blood thinners, I didn't want to have to get my INR checked and things like that, and also the ticking of the valve, obviously that puts you off a lot as well. So before she came that night, I kind of, you know, I'm not a religious person in any way, but I am a very spiritual person. In fact, I do, you know, as well as sing, I also do readings for people and things like that. And it was kind of, I sat down and I just had a place and a time with God, and I said, God, please give me a definite answer where I need to be with my body right now, and what decision do I need to make about this valve. And when she came in to see me, the doctor, when I then asked her about, you know, because she said, have you made any decisions? And I said, I'm still none the wiser, to be honest. And this was the night before, and she was like, wow. And she said, well, I will tell you this, because of where the valve is, and it's an outlet valve, and it's the aortic valve, and it's used a lot, and because of your age, you'll be looking at 5 years, and then, you know, we could see you back here. And to me, that was a clear-cut decision. You know, I'd asked for that clear-cut decision, and there was no thinking about it at that point then. Because if she'd have said probably 10 years again, I'd have probably swayed towards the pig's valve, like a lot of you do. So to me, I got the answer that I needed. And I also ask for strength and guidance, and this is something that you can do, because you have to surrender. At some point, you're going to have to sit back and surrender and say, you know what, it is what it is, and I need to do this. But you can ask for help, because Spirit and guides and God are all around you, and they will protect you, but you just need to learn to ask and surrender. And letting go of that control and surrendering it and say, God, this is your body, do with it what you will. I trust and have pure faith in your judgment, and believe me, it will come. I'm wishing all of you that are going to surgery a fantastic healing and a fantastic recovery, and I just want you to know that things do get better, and you will get on the other side of it, as I have. And you know, you take each day as it